Hi, I'm Dr. Bill Lyle, and today's topic is LUTO, L-U-T-O, lower urinary tract obstruction, also known as bladder outlet obstruction. It's a rare condition, but it's just one more of those conditions that we can diagnose and treat while the baby is still in the womb. Well, what is LUTO? One of the first indications that a baby has LUTO, lower urinary tract obstruction, is that when we do an early ultrasound, we immediately notice there's not much fluid around this baby. Well, the majority of fluid around the baby is actually fluid that has been released by the bladder. It's created by the kidneys. Well, when we look and we see we don't have much fluid, that means that we don't have much urine. Well, where is it? Well, number one, it could have leaked out. Number two, the kidneys aren't producing enough fluid. Or number three, there's a bladder outlet obstruction. And we can notice this because there's not much fluid around the baby, but the bladder is just bulging and filled. And even the ureters, which drain urine from the kidneys down to the bladder, they're even swollen. Well, that's pretty much diagnostic of bladder outlet obstruction. It's rare, but this can kill babies in the womb because there's so much pressure going back up to the kidneys that the kidneys can actually die on the inside. So what do? We actually will evaluate the baby. We'll send them to a center which does this regularly. They will use ultrasound. They'll numb up the mom's skin. They'll use ultrasound to actually guide a thin little wire, a trocar, through the skin of the mom, through the wall of the uterus, and then they'll go right up to the front lower portion of the baby's abdomen where the bladder is. They'll take this trocar and they will go through that lower skin of the lower abdomen of the baby, and they will place a shunt or a stent. This is a thin tube that is stretched out over that wire that was sent inside, but once one end gets on the inside, they will back out the guide wire, and that end will coil up and stay in the bladder. Then as they pull the guide wire further out, the other end will then coil up, and that will be in the amniotic sac. So we have one end in the bladder and the other end that is in the amniotic sac, and now the bladder can drain, and it will continue to drain throughout the pregnancy, and the baby will continue to grow and continue to develop. Once that baby is delivered, then they are evaluated by a pediatric urologist who will look at the outlet obstruction of why the baby wasn't able to pee on the inside. They can then do a surgical repair, and these babies do great. A patient is a person, no matter how small, and LUTO is just one more way that we don't just diagnose and treat, but we can actually cure babies in the womb. And a patient is a person, no matter how small. If you have any questions, you can contact me through our website, which is prolifedoc.org. I'm Dr. Bill Lyle. I've practiced obstetrics and gynecology for over 30 years, and I've delivered over 5,000 babies. So yes, the babies in the womb are patients, and all patients have rights. Defend the most that are defenseless and stand up for the rights of all patients. God bless you all and have a wonderful day.